let's just shift the gears just for a second and kind of talk about what I think is the second big driver that we need to look at as we're trying to really think about the patient experience. And we talked about this in the first webinar we did back in the beginning of the year. And we talked about there are a number of drivers that are changing the healthcare industry specifically. The first one we talked about is that there's a change happening within kind of the market itself. The patients, the families of the patient, the pay systems, the providers, the market's changing at a rapid rate. And what we're finding is the changes to these drivers, where they may have changed over time, 5 or 6 years, you get 1 or 2 changes that are happening. We're finding it's now changing in weeks and months. And we saw that during COVID. I think that this comment you said in 20 days, we did more changing than we did in 20 years, right? And I think that's a fact of life today. Our ability to respond to these changes are really important. So when I think about this, it's really kind of what I call minding the gap, is that we have to have a thought on what the drivers are, what the patients are expecting, for example. We need to make sure that we identify those drivers and we prioritize them, we put focus on them. The second thing that I look at is that we have to get more proactive and actually anticipate when these drivers are going to change, instead of waiting for them to change and taking time to do this. And what happens when we do that, if you look at this graph, the blue or teal line represents the rate of change that's happening within the industry. And as we're slow to respond to those or identify those changes, that orange line represents where any particular practice or healthcare center would be at any point in time. And you can see there's a gap that starts to creep between them, and there's a misalignment. With the technologies available today, no one should ever have to wait on hold for 5 or 10 minutes not talking to a person. There's technology that can solve that problem in minutes and create just a better experience. And then what I think happens is that we have to look at deploying technology that can bridge this gap, pull that gap, closer together, so we're not misaligned with that. So when we talk about this and we think about how that gap may get bigger or smaller and how we can control that, what I want to focus on, and Charles, we'll start with you on this one, is kind of what's working. What have you seen working to actually close this gap and create better experiences and better outcomes for our patients?
Well, one of the prime directives that I have as a CIO here at Shasta is to try, to the best of my ability, to remove as much noise from the acute care visit. Again, I work in the FQHC space, and so a lot of what we do here is dictated to us. A lot of it makes sense. A lot of it we're given decent tools to use. I'm talking of things like screening tools, assessments, and whatnot. Every year they seem to be adding more, and they never take any away. Well, the end result of that is that your acute care visit is really just data gathering. You can't really process the answers to these questions in real time because all the time's being taken up just getting the information. So one of the things that we've done is we've leveraged our patient portal and created a lot of the forms where we can, where risk is managed appropriately, et cetera. But what we do is we query the system for everybody that's got an appointment the following week, and we pump out a lot of this stuff to them in advance. So they can sign consent forms, they can sign their notice of privacy practices, they can fill out a PHQ-2, they can do a staying healthy assessment. So all that information, they're helping us, right? So they're entering the data, staff is not. And so once it's there, then as part of our planning process, our pre-visit planning, we can take a look at what their answers were and focus on some areas of risk if we can. And so that helps in a number of ways. We're also on the hook for several QI metrics that have to do with the preventive model. To the extent we can front load that using technology, we're all the better for it.
That's awesome. Well, yeah, I know when I mentioned I broke my wrist. I broke my wrist. I went to an orthopedic surgeon, and so I was about ready to get my cast off, and I had to go in and I had to fill out all the forms. The 4 pages of forms, things I had to sign to say that, HIPAA and all that kind of stuff. I acknowledge that. And literally go in there and have the conversation. So they'd say, once the cast comes off, you have to go to physical therapy. I literally walked out of the doctor's office, walked across the lobby to another facility that did physical therapy that had the exact same name, only physical therapy after it. And they gave me the same exact forms to fill out again. It's like, it's like craziness. You think if I filled them out once or I filled them out at home, I could have, avoided all that kind of time. It would have been a little bit easier because, writing with the cast on wasn't all that easy. So kind of building on that, Steve, when we think about this and we're making these shifts and we have things that are changing, obviously you guys are helping companies, put in technology and workflows and systems that automate this. What do you think changed in the last 2 years? I mean, there's a lot of rapid changing things moving. What did you see happening that was good with, adoption of technology to create better patient experiences?
Well, as I mentioned earlier, obviously the pandemic was a big influence on where care could be delivered. People were not able, in particular in elective procedures, to go get procedures. People were cautious about the healthcare system. They thought, they could be exposed in that environment. So folks started becoming much more consumer friendly. Just like someone mentioned, we were forced to shop online. We were forced to educate our children online. So now we said, why can't we do more healthcare online? So a significant amount of individuals that had never tried telemedicine, vice versa, practices that never implemented telemedicine, implemented it. Statistically, though, it was driven off of existing patients. It wasn't very heavy on net new patients. So you had a relationship there. It was also very heavy on behavioral health. I think in 2019, 1% of Medicare Part B visits were telemedicine. By spring of 2020, it's 13-14%. So that was a big driver. As we mentioned too, the downside of the pandemic, among everything else, was the reduction in the labor force. So practices had to be able to fill redundant tasks and automate tasks. And that's where technology started to really creep in. Things they may not have used in the past, they had to use. Charles pointed out, and Charles is a thought leader in this environment, the patient is the one who has all that subjective data on themselves or whoever is being cared for. Why not push that back to them to complete it? Why should we have a staff member regurgitate it down? Let's everybody work at their pay scale, we always say to clinics. So that really helps the automation of that. And whether it's on a portal, on a smartphone, on a kiosk, I mean, we can all check in the Southwest online. Yeah. We should be able to do this in healthcare. So those were the real driving factors. Now, I would argue it's gotten more confusing these days because there's been hundreds of digital health companies coming into the market, and your practices and your healthcare systems are probably a little overwhelmed with choices. So again, I go back to understanding your patient. And then, as Charles said, understanding what we can be doing from patient experience. And it's that primary care, medication refill, check-in type of situation that doesn't necessarily need a face-to-face visit. That's where we begin, and we grow from there.
Yeah, I like that. My business that we talked about during the intro was known well in the industry, not only being a technical organization, but providing what we call the ultimate client experience. It was focused on customer service. And what we realized as we were going through our 20+ year journey of building that organization was you had to design it. You had to have a vision of where you wanted to be. You had to design the experience. And I had one very smart thought leader that came to me once, and I was complaining about things weren't working as well as I wanted it to. He says, it's working exactly the way you designed it, right? So the healthcare industry, what we get today for that experience is exactly what's been designed in. We can change that design at any point in time. So I like where we're going with this.